Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on the hidden secret number 25 of why you could still have back pain. In this video, the hidden secret number 25 is due to a condition called fibromyalgia. You may have heard of fibromyalgia before, but you may not have understood really what it meant. The word fibromyalgia literally means pain in the muscles and the soft tissues. And it was traditionally what I call a throwaway diagnosis that was done by medical doctors where they had no idea what was going on, but they felt that they had to give it some kind of a title. And for the longest time, medical doctors denied that this was even a real problem. For years, they thought that people that had chronic ongoing pain were either faking it, or they were malingering, or they had something going on in their head that was driving the problem. And the truth of the matter is that fibromyalgia is a very real condition. Now, the thing about it is, though, even if you have pain in the muscles, there is nothing wrong with your muscles. They have actually biopsied or taken out pieces of the muscle tissue in areas where fibromyalgia patients complained of chronic ongoing pain. And what they found was that the muscle tissue was perfectly healthy. There was nothing wrong with it. And so that was one of the reasons why the medical doctors for years denied that this was even a real problem, and they would just use this wastebasket diagnosis for people that would come in and tell them that they're hurting, and the medical doctor wouldn't need to know what to do about it. Over time, medicine has evolved to the point where they've accepted that it's a real problem, but they're still not quite sure what to make of it. And so that accounts for why the number of different prescription medicines for fibromyalgia can range from non-steroidal inflammatory drugs to all the way to antidepressants and even cortisone injections. Now, the problem there is that you're throwing medicines at a patient without having even the first clue of what's driving the problem in the first place. And I don't really think that's a good approach. I think that what you have to do is to consider that there's a reason why these patients that suffer with this problem have the problem in the first place, and you have to do a little bit of detective work and figure out what's going on. And what we found is that there's a couple of different reasons why what drives fibromyalgia pain. It's a multifactorial problem. That means that there's no one quick and tidy, neat solution to the problem. There are neurological components, there are physical components, and there are metabolic components. And I'll explain what I mean by that. The neurological component could involve an overfiring of the part of your brain called the midbrain. The midbrain gets signals from the cortex, or the big covering of the brain, which then gets signals from the cerebellum, which is the part of the brain in the back. And that receives information from your spinal cord. And that's why when chiropractic patients get adjusted by a chiropractor, the chiropractor adjusts the spine, which sends a signal up to the cerebellum, which then goes to the brain, which then goes to the midbrain and shuts down that pain. That's why chiropractic care is one of the most effective therapies for fibromyalgia. The second component is a physical problem, and that would involve your joints in your spine. It would involve your muscles themselves, and that could be due to tightness or trigger points or deconditioning. It could be due to a previous injury that has to be rehabbed correctly. So in my office, the way that we handle that is to restore motion to the joints and the muscles, followed by realigning the spine, realigning the pelvis, and realigning the posture. And then once we've accomplished that, then we put the patient on specific exercises to bring back strength and stability to the spine. And that corrects the physical component of the fibromyalgia mystery. And the third part is a metabolic issue. And that has a lot to do with your diet. It has a lot to do with the amount of inflammation that you have in your spine that's due to fatty acid metabolism problems, either because you're not getting enough omega-3 fatty acids, or you're overdoing it with processed foods or sugar or grains and other types of pro-inflammatory foods that are lowering your pain threshold and causing you to hurt a lot more. So in my office, we have to take a look at the neurological component, the physical component, and the metabolic component as all viable solutions to the fibromyalgia problem. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions about fibromyalgia or back pain, please feel free to communicate with me through my website at redapplewellness.net. Please also subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.